All right, good day, anatomy students. Today we're going to finish up talking about the male and his role in the reproductive system. So let's go ahead and get started. All right, today we're going to talk about the male and finish up all the lecture material on the male component of the reproductive system. So let's begin talking about the male hormone, which is testosterone. Testosterone controls the growth, development, functioning, and maintenance of the sex organs, stimulates bone growth, protein anabolism, which would be converting protein into muscle tissue. And that explains why testosterone will stimulate bone growth. The male, because of the larger muscle mass than a female, the male needs a bigger, stronger, more robust skeletal frame to help support that muscle mass. It will also help with sperm maturation. It will stimulate development of the male secondary sex characteristics, which will include the starting of body hair, as in chest hair and pubic hair, beard growth. It will also include the widening, the increased size of the larynx, which will then provide a deeper voice than females. And that's when, you can tell that a boy is going through puberty, because his voice will crack. And that is he is trying to get used to using a larynx that is changing size. And that's why the voice cracks in a male during puberty. The duct system of the testes includes the seminiferous tubules, the straight tubules, and the retitestes. Sperm are transported out of the testes through the efferent ducts of the epididymis, which empty into a single tube called the ductus epididymis. The vas deferens, or seminal duct, stores sperm and propels them toward the urethra during ejaculation. Some of you may have heard of a procedure called a vasectomy, which is a surgical procedure done on a male in which the tube, the vas deferens, is cut and the ends are closed. They used to tie knots in the end of the vas deferens, though I think today they just cauterize the end, burn the ends closed. And this will then prevent the man from being able to add sperm to the mixture of semen. And so there's a misnomer out there that a man who has had a vasectomy eliminates nothing during ejaculation, but that is not the case. As we're getting ready to find out, semen is a mixture of substances, of which sperm is one of those mixtures. So here, and let's talk about that right now. The seminal vesicles secrete an alkaline viscous fluid that constitutes about 60% of the volume of semen and contributes to sperm motility and viability. So right there, 60% of the mixture of semen is a secretion from the seminal vesicles. That this fluid gets the sperm swimming, gets those flagella doing their job and propelling that sperm cell towards its destination. The prostate gland also secretes a slightly acidic fluid that constitutes about 13 to 33% of the volume of semen. So right there, the seminal vesicle and the prostate gland are going to make up most of the mass or the volume of semen. And it will also contribute to sperm motility and viability, get those little guys swimming. And the Cowper's gland secretes mucus for lubrication and alkaline to neutralize acid. So the man's urethra is the last tube that sperm cells will travel down as they leave the man's body. And the urethra is also the tube that urine will take to get out of a man's body. And urine is acidic, so the man's urethra is going to be slightly acidic, and the Cowper's gland will help secrete, or the secretion from the Cowper's gland will help neutralize the acid in the urethra. Also, the woman's vagina is going to be acidic as well, and the Cowper's gland will help neutralize the acidic environment of the woman's body. Semen is a mixture of spermatozoa and accessory sex gland secretions we just talked about that provides the fluid in which spermatozoa are transported, provides nutrients, and neutralizes the acidity of the male urethra and the woman's vagina, which is what we just talked about. The volume of semen in a typical ejaculation is about 2.5 to 5 milliliters, with 50 to 150 million sperm per milliliter. 50 to 150 million per milliliter, and 2.5 to 5 milliliters during a normal ejaculation. So at 2.5 to 5 milliliters with 50 to 150 million per milliliter. So let's do some math real fast. Let's say let's kick it right down the middle, and let's say we're at 3 milliliters or 3.5 milliliters in the average ejaculate. And let's say we keep the numbers at average, and let's just say we're at about 100 million per milliliter. At 3 to 3.5 milliliters, that's 3 million or 3.5 million sperm cells per ejaculate. That is a lot of sperm cells. Now, they say it only takes one to fertilize the egg. There's going to be a sacrifice made as soon as the sperm cells are deposited in the woman's body due to the acidity of the vagina. There will be 6 to 7 million die instantly, and their sacrifice will then reduce the acidity of the woman's body and will enable the other 290 million will enable them to do their job. When the number falls below 20 million milliliters, 20 million per milliliter, the male is likely to be infertile. So even at 20 million per milliliter, that would be infertile. So that just gives you an idea of, they say it only takes one, but in reality, it takes millions for that one to be successful in fertilizing the egg or oocyte. The penis is the male organ of copulation that consists of the root, the body, and glans penis. It is used to introduce spermatozoa into the vagina. Expansion of the blood sinuses of the penis under influence of sexual excitation is called an erection. And then the ejaculation is the propulsion of semen from the urethra to the exterior, and it is a sympathetic reflex, or that means it is in the response to certain stimuli. It is not under conscious control. Covering the glans penis is the loosely fitting prepuce or foreskin, and the removal of the foreskin is called the circumcision, and is a surgical procedure in which part or all of the prepuce is removed. And I believe this was started with the Jewish religion and has now become a regular option when babies are born, male babies are born in this country. It is something that parents are asked when they're born if they want their baby to be circumcised. And it is a fairly regular procedure done in this country. And basically the reason is it's just a cleanliness kind of thing. It's just a little easier for a man to keep things clean when there is no foreskin. And while we're talking about surgical procedures, gentlemen, the previously mentioned vasectomy, I know we talked about it. I'm sure some of you cringed, but the procedure itself is much easier on a man than having a woman having her tubes tied. That's an abdominal surgery because, the fallopian tubes are found inside the woman's abdominal cavity, and the recovery from that surgery is much more difficult than a man's recovery from a vasectomy. It is an outpatient procedure. They don't even put you under. You're given a local, and they make a small incision in the scrotum, and they find the vas deferens, they snip it, and they cauterize the ends, throw a couple sutures in you, and send you home. You then spend the next few days sitting on ice bags or frozen vegetables, and as long as you don't lift any heavy things for the next few days, you're fine. The recovery is much easier. The procedure is much easier on the man than it is on the woman. So, gentlemen, in years from now, when you get married and you and your wife have decided that you don't want any more children and you are contemplating the different surgical procedures, step up to the plate and have the vasectomy for your wife. It is much easier on you than it will be on her. So don't let your masculinity and pride get in the way. It is the right decision to make. So keep that in mind when you get there. And that is going to conclude the lecture material on the male. All right, that covers all of the material we need for the male. And the next video will begin talking about the much more complex component of the female reproductive system. All right, so don't forget, click like and subscribe, and we'll talk to you later. And as always, thanks for watching.